All right, so the two types, okay, sorry. The first type of spinal bifida, that's the spinal bifida occulta. And I told you guys, we had an overview video on the spinal bifida where I told you guys about, we had, we spoke about spinal bifida, and also um, we spoke about the different types of spinal bifida too. And spinal bifida was the first listed one, okay, because this is the less serious one. All right, so in that order also we are going to make videos on this. All right, so spinal bifida occulta is what we're going to talk about in this video. I'll be talking about the causes, we'll be talking about the features, and the possible treatment should be surgery. Do you understand? Because it has to do with the anatomical structures, so you have to actually perform a surgery and get them back to place. So spinal bifida occulta, we said that spinal bifida occulta is the least serious and most common type of spinal bifida. It is usually discovered only on X-rays or scan. Now, most people never become aware of their condition because it is not serious. Okay, spinal bifida occulta, there is no really an opening, all right, like spinal bifida with meningocele or spinal bifida with myelomeningocele. Do you understand? The occulta, there is just like an elevation in the spinal cord, and you could have a tuft of hair around it. Okay, this is the hair patch, also known as tuft of hair. Do you understand? So, spinal bifida occulta is a small dimple with a tuft of hair, or you could say a patch of hair arising from it. So spinal bifida occulta is mild form of spinal bifida. Forget about its numbers. It is caused by a gap forming between the vertebrae in the spinal cord during fetal development in the uterus. Do you understand? So the spinal cord, the vertebrae, okay, that the spinal vertebrae is not actually forming complete. So there's like a defect in it. Do you understand? So now it is sometimes called hidden spinal bifida because there's a small gap in the spine, okay, but there's no opening or sac on the back. All right, like you see this one, there's an opening, there's a sac. Do you understand? There's an opening, there's a sac filled up with meninges. Spinal bifida with myelomeningocele filled up in meninges, cerebrospinal fluid, nerves, and the spinal cord. All right, while the spinal bifida with meningocele is just filled up with the meninges only. All right, that's meningocele, okay, with sometimes cerebrospinal fluid. Definitely cerebrospinal fluid. All right. So now we say that it is sometimes called hidden spinal bifida because there is just a small gap in the spine with no opening or sac on the back. Now the spinal cord and the nerves are usually normal. Now many times spinal bifida occulta is not discovered until late childhood or adulthood. Now this type of spinal bifida usually does not cause any disabilities. Okay. So guys, this is it about spinal bifida occulta. We spoke about the definition, the causes, and the features. And I told you guys that the treatment should be definitely a surgery, okay, that is actually looking to actually repair the defect, okay. So guys, that's it. Check you guys in the next tutorial on the another type of spinal bifida. In the next one, we'll be talking about spinal bifida with meningocele. So stay tuned to our YouTube channel. Bye for now.